is Edgardo Ramirez. Oh, we just got the notice that it's being recorded. Awesome. So my name is Edgardo Ramirez, and I'm a core manager for the Chicago Czech Partnership and at Northwestern University's Center for Health Equity Transformation. And so we're still just going to give folks a few minutes to trickle in before we get started. In the meantime, though, just wanted to please ask of everyone joining us today to please keep your microphone muted while others are talking during the discussion portion of the event. And if you have any questions, please feel free to drop them in the chat, and we'll try to get through as many questions as possible during the event. We have some really great discussion that we'll be having today, and we'll just give folks a few minutes to join, and we'll get started. All right. Alicia, Melissa, can you guys see that I'm sharing just the presentation now?
Yes.
Awesome. Okay. Actually, let me go back here. Getting a little ahead of ourselves here. All right. Okay. I think we're ready to get started. So again, just want to welcome everyone to today's Chicago Czech's virtual community conversation to identify resource needs for community members during COVID-19. As for some background, the purpose of this conversation is for community-based organizations to share their work and services, and for all of us to have a discussion about the current needs of the communities in Chicago. We also want to throw a plug for our next conversation that we'll be having that's going to be directly informed by this conversation. That'll be on February 24th from noon to 1. We'll be having a virtual community resource fair where we hope to share a lot of the priority areas and resource needs that are highlighted in today's discussion. And so we'll be sending a calendar invite along with a flyer for you to share with your networks soon after today's event. And in addition to that, we just want to also give the intro that this event is brought to you by the Chicago Cancer Health Equity Collaborative. For those of you that may not be as familiar with the Chicago Cancer Health Equity Collaborative, our acronym is Chicago Czech, and we are an NIH-funded partnership that collaborates with Northwestern University, University of Illinois at Chicago, Northeastern Illinois University, and community partners across the city. And our mission is to advance cancer health equity in Chicago through research training, education, and community engagement. And one final announcement before we get started with today's topic. We are currently recruiting and accepting applications for our Chicago Czech Summer Research Fellows Program for summer 2021. So this program is an 8-week paid training program for undergraduates and post-baccalaureate students who are interested in pursuing social behavioral biomedical research and healthcare careers. And so we have the flyer up here for everyone to see, and we'll be sharing the link to access the application in the chat as well. I believe the application deadline here is February 28th of 2021. So folks still have plenty of time, and we would love it if folks could share this with your networks, because it is an amazing program, really rich opportunities for students. And we've always had really positive feedback from previous students in the program. So with that, without further ado, I would like to introduce our facilitator for today's discussion, Dr. Aida Giacello. Dr. Giacello is a research professor of preventive medicine and a medical sociologist at the Northwestern University Feinberg School of Medicine. And for over 35 years, Dr. Giacello has conducted health disparities research, evaluating intervention programs that impact families and communities in the areas of tobacco prevention and control, chronic diseases such as diabetes, high blood pressure, and cancer. And her research employs community-based participatory research and empowerment approaches. And she also mentors graduate students, early career faculty, and community health workers. And lastly, but certainly not least, she is also one of the outreach core co-leads for the Chicago Czech Partnership. And with that, I will now hand the mic over to you, Dr. Giacello.
Good afternoon. Can everybody hear me well? Okay, we're going to have a very exciting session this afternoon where we're going to be hearing from you and from your perspective, representing your organization and your communities about what are the needs during this pandemic period. As you know, we had a similar kind of discussion in March, April, and we are now 9 months into the COVID-19 pandemic, and we wanted to reassess about what are the community needs, what are the strategies that are using. So what we're going to be doing today is raising a series of issues on a number of areas and getting your responses to those many concerns. But before we do that, we want to begin by introducing each other. Can you please tell your name, your affiliation or position, the organization that you represent, and the community or communities that you are serving?
So can I go first? Hello?
Of course. Go ahead.
Yeah, go ahead, please.
Okay, my name is Amin Karar. I'm a student at Northeastern Illinois University, and I currently live in West Rogers Park, but I used to live in dorms at NEIU. So I also serve at Albany Park and North Park. I live in Chicago.
What are the community that you are currently serving?
I currently serve West Rogers Park, Albany Park, North Park.
Albany Park.
Yeah.
Very good. Well, thank you so much, Rabin, for joining us. Who wants to follow?
Hi, this is Joanne Glenn. I can follow. I'm part of you, part of Czech. I represent the White Foundation. I am a nurse and here to listen, learn, and contribute.
Wonderful, Joanne. And for many of you, Joanne is the co-chair of the Community Steering Committee. She's been with the Chicago Czech for over 5 years, providing tremendous amount of leadership and really educating all of us with her wealth of information. So thank you for being part of this group and providing the support. Do you want, Joanne, to say the communities that you serve?
Sure. I'll serve where the need is, but we are located in Bronzeville, Hyde Park, serving Chicagoland and some of the suburbs, County of Cook.
Wow, great. And who would like to be next?
I'm happy to go next. This is Stephanie Lieber. I'm the Executive Director of Immerman Angels. We provide peer-to-peer psychosocial cancer support for cancer survivors, cancer fighters, previvors, and caregivers. We are headquartered in Chicago, but we work nationally and internationally. So we serve all of Chicago and beyond.
Wonderful. Thank you, Stephanie, for joining us and for having such a broad base of constituency that you're providing very important services. Thank you for that. Who's going to be next?
Maria Olivero.
Okay, Maria, great.
My name is Maria Olivero. I'm working with UIC at the Cancer Center, and I have a partnership with Norwegian Hospital with a free cervical cancer program, and we are serving Humboldt Park, Hermosa, West Humboldt, Logan, Avondale. That's in the area of Humboldt Park.
Wonderful. Thank you, Maria. I haven't talked to you for a while, so I'm happy that you were able to join us. Maria and I, we have worked in other projects, particularly the All of Us project at UIC. So I'm glad that I have a chance to say hello in this particular
Nice to see
event.
you, and happy birthday.
Gracias. And so who's going to be next, please?
I can go next. Hi, my name is Rachel Cha. I'm from Hana Center in Chicago, and we're located in Irvine Park. And then the community that we serve are mostly Korean immigrants, and then other immigrants living in Chicago. And then our clients are mostly Korean, Latinx, and African American, and then other immigrants who lives in Chicago.
Great. That's wonderful, Gresham. Thank you for joining us.
Thank you.
Who wants to follow?
I can follow. This is Anna. I'm with BDMAG, joining together with Terry Weiss today. And so we're representing bone marrow registry, and I primarily serve Chicago and Chicago suburbs area.
Wonderful. Gracias. Thank you, Anna. And who would like to be next?
I can go. Hi, this is Lisa Tusing-Humphreys. I'm part of the Chicago Check team. I'm a registered dietitian and researcher at UIC. My research focuses on cancer prevention and cancer health equity, and I serve the UI Cancer Center catchment area, as well as UI Health in the greater Chicago area.
Thank you. And Lisa is an active member of the Chicago Check, the community outreach core. Thank you, Lisa, for being with us. Anyone else that we've been missing?
Hi, I'm Laura Jane Hyde. I'm with Gilda's Club Chicago. We provide support to anyone impacted by cancer, as well as family members and friends. So we're virtually for everyone, as we know every family is touched at some point by cancer. We are part of the cancer support community, which is a worldwide network of support. And in addition to the affiliate network, we have a research and training institute that develops evidence-based tools to provide cutting-edge support, and a policy institute which advocates at the state and national level for nonpartisan policies that support anybody impacted by cancer.
Thank you so much, Laura, for joining us. Who would like to follow?
We do have someone on the call, Chris Ellis, who he said he's having issues with his mic, but he did write in. I am Chris Ellis, a senior analyst at Vizient Inc., also grad student at NEIU, interested in language policy, serving Chicago, specifically Ravenswood. So thank you, Chris. We're happy you're here.
Well, good. Thank you, Chris, for sharing that information. I know that about 8 people have introduced themselves, and we have about 23 participants in this call. Is there anyone that have not introduced themselves that would like to do that at this time?
Dr. Giacello, this is Erica Martinez, and I work at the University of Illinois Cancer Center, and I'm part of the Chicago Check team. And we serve the Cook County catchment area. I'm part of the engagement team at the Cancer Center. So our job is to make sure that we have community engaged research and make sure we're providing the information to researchers on community needs. It's really good to hear everyone on the call. Thank you.
Thank you, Erica, for being part of this discussion today. I also know Erica for the longest time since we were working together in Health and Medicine Policy Research Group some time ago. So it's always so nice to see you and to hear from you and to know the wonderful work that you're doing. Gracias. Anyone else that we've been missing?
I can jump in. I'm Ellen Nieman. I'm a social worker at Wellness House. Our main location is in the western suburbs, but we serve anyone impacted by a cancer diagnosis throughout the Chicagoland area and have some partnerships with other hospitals and nonprofits, both in the city and in other parts of the suburban area as well.
Wonderful. Okay, I know that some of the staff can also introduce themselves if they like to. So we could all have a, level the field in terms of who's here.
Hi, I'm Alicia Kalamian. I'm a community health educator with Chicago Check on the Chicago Check team on the NEIU side. Welcome, everybody.
Thank you, Alicia. Anyone else that we haven't heard from?
This is Ifeanyi Beverly Chukwudozie. I'm the Side Program Director of Chicago Check at the University of Illinois Cancer Center. I'm so excited to listen in and hear what everyone has to say.
And she's also a key member of the Chicago Check, the community engagement core. And I think there's someone by the name of Jose Aguinaga. Jose, would you like to introduce yourself? He's in mute. How about Terry Haid? Or for that matter, Melissa Martinez and Edgardo.
Oops, I apologize. I was on mute, and I actually work with Anna, who already introduced herself, and we are with Be the Match, and we cover all of Chicago, and we're working to add more ethnically diverse donors to the Be the Match registry for marrow and stem cell donors.
Thank you, Terry. And Jose said that he preferred to listen for the time being. So thank you, Jose. Let me see who else we haven't heard from. I think that cover at least the majority. Rabi, do you want to introduce yourself by any chance? And Edgardo?
Yeah, I introduced myself earlier, but for those, but that was a little earlier before I think a lot of folks joined. So again, my name is Edgardo Ramirez, and I am a core manager and clinical research coordinator for working within the Chicago Check Partnership on the community engagement core, outreach core, and also work at the Northwestern's Center for Health Equity Transformation. And yeah, I'm really excited to be here too, and with Aida here and the rest of the Chicago Check team. So welcome again, everyone.
Wonderful. Okay, so why don't we move on? And if anybody who came late and want to introduce themselves, they're welcome to do that. Like I mentioned before, we really want to hear from you today, and we have a series of questions that we want to ask to all of you, and hopefully you will be able to share your thoughts. It's part of our ongoing conversation, discussion, dialogue with the community, specifically as it relates to identifying resources that are needed in the community, particularly during this period of the pandemic. And how are you really, what are the challenges in trying to address the diversity of issues that the community are bringing to your attention? and the ways, the mechanism that you use to communicate with them. So with that, if we could have the next slide, they would ask the first question, then we could get started. But before we do that, actually, there's a list of priority that many of you identify when you register for this event. And we asked you a similar question about what were your resources priorities. And some of you mentioned healthcare access, other mentioned financial support, other mentioned emotional support. So let me start with the main one, healthcare access. Can any of you be able to share what do you really had in mind when you were thinking about healthcare access as an area of priority? Who would like to speak to that particular issue? Are you referring to the quality of the care or not being able to have access because of lack of health insurance or not having a regular provider that speak your language in your community? Who may want to give us an idea about why healthcare access emerged as the top priority for many of you who responded to that question during the pre-registration?
Hi, this is Joanne. I did not respond to that question, but I'm faced with that question often. So I would like to add something with the community that I serve, which are breast cancer survivors and access to care. Some of the fears, of course, is the pandemic, where some of the ladies are not keeping their appointments or going out because they're already immunocompromised, and they think going out they would be more susceptible to the COVID pandemic that's going on. So there's a big concern of whether or not the telehealth has been effective or some treatments are being missed because of, again, being afraid to go out into the system right now.
So if I heard correctly, there's fear. Even people don't have access to telehealth or don't know how to access it effectively. The issues with appointment, getting the appropriate appointment in a timing basis. Did I capture that correctly, Joanne?
You sure did, and thank you.
Any other issues related to healthcare access from Joanne or anybody else in the group? Who else responded that healthcare access was a priority issue? Do you want to share with the group your thought? How about the other issues in that list, such as financial support? What is happening in our community? What is happening with the people that you are providing services? What are they telling you regarding financial support or lack of financial support financially?
Well, some might say that it's inadequate or not enough, and others might say the opposite, that it's too much for those that are seeking help. At what point do we stop assisting those that are doing without?
So I'm a little bit confused. You said that for some people, they're not too much or not enough, and for others, it's too much. What are you trying to say there, Jose?
I'm saying that it's a double-edged sword when it comes to financial assistance for some.
Mm-hmm. And so how all of you in the community are addressing the financial need of the community or your constituency specifically?
For me personally, I've been applying jobs, and what I've been doing with jobs is that I've been calling them back. I've been trying to find emails and be proactive with that. But also I've been taking time to do some volunteer work as well, because I feel giving back to the community helps also, just to keep myself busy. So depending how you look at it, it can go either way. Me personally, I have savings, so I could get away with not working a little bit, if that makes sense. I don't mean to spend any.
Yeah, it makes sense. And so in your case, you are worried, perhaps concerned about the financial aspect. And although you have a little bit of saving, you don't know how far that would go, right?
Yes.
And so what do you think about other people, how they're managing?
I think that people just don't, especially young people like my age, my college student people. Sorry, that doesn't make sense, but it's hard because there's so many things you want to do. There's so many things, opportunities, so many things you want to buy, especially this holiday season, that you just can't do, and it sucks. But bright side is, if you think about it, is that, you know, how can you manage and how can you make the most of it without feeling like it's not good, like nothing's gonna go well, if that makes sense.
Does make sense. Thank you for sharing. And what can we do? I mean, one of the things we want to do today is identify resources, a way in which we could be able to address those kinds of issues that people like yourself and others are experiencing. Any idea?
Well, maybe a good way to stay on top of what resources are available to you in your community is maybe reach out to your alderman, maybe your congressman, maybe your maybe a church or some kind of faith setting, if that's your thing, and just seeing what's available to you in your own community. So
I agree.
Very good. That means that whatever problem you have, you should be able to reach out and not really keep it to yourself. There are resources there, and there are groups and organizations, including elected officials, that can very well be able to see how they can best help you or let you know what resources may be available. But before we move on, how about other people who responded to emotional support? What's happening there with emotional support? And there were some individuals that mentioned employment and housing. Do you see a lot of need, and all of you, do you see needs in those areas as well that is affecting our communities?
Yes, because without emotional support, without community, it feels like nothing's gonna get better. At least for me personally, I feel like communication is a key thing we need to take away from this. That if we communicate, we don't keep it to ourselves, we'll be fine almost. If that makes sense.
Yes. So what do you mean by communication?
Talking, reaching out, people, emailing, phone numbers, texting, calling. Like, be a voice.
And do you feel that's not happening?
Not as much. I feel like people are starting to give up now with the pandemic. A little bit, they're tired of being home all day. And I get it, but you know, it's just a couple more months. They'll be back to normal, hopefully.
Thank you. And how about others? How about Teresa or Terry?
Erica.
Yeah, go ahead, Teresa, Erica.
So I just quickly wanted to share, I think one of the questions was, what are we doing sort of for our community and patients? And for us, we've really taken a more individual approach with some of our patients in our community in terms of helping them apply for some, especially for cancer survivors, helping them fill out applications for different awards or different assistance. So it is taking us more time because instead of being able to do things in a group setting, we have to do things a lot more individualized. So that has helped, at least with some of the emotional support that I think our navigators are providing the community that they didn't anticipate providing. So we're also making sure that they're receiving mental health training and that they're being supported as well. So I just wanted to share that in terms of some of the things that we are doing.
Thank you for sharing that. The area of mental health and social well-being is a very, very critical area in this time. And we really need to help each other, reach out to each other. Actually, the state of Illinois is going to be launching a whole mental health and suicidal prevention in the next week or so as a result of the cases increasing dramatically in the state of Illinois and in the city of Chicago. Any other comments about resources priorities that many of you in your pre-registration mentioned? There's a laundry list. What I do notice is that some of them were also mentioned when we did this 5 months ago. So it seems like there's been a constant concern, particularly with social and economic issues, as well as mental health or emotional related issues that is affecting our communities. And so this is an area of great concern. We're trying to figure out how can we best help each other and share resources that many of your agencies may have that others may not know about, and that this kind of forum can also provide that opportunity of sharing resources. Any final thought before we move into some of the questions that we have listed for all of you?
Hi, my name is Yeram Cha from Hana Center. I can share some of the resources that we had from our organization. So mostly the community that we serve are low-income families and the immigrants. So we were able to help our community members by helping them to apply for SNAP benefit for the people who were struggling with the food insecurity when they lose their job because of COVID-19. And then we also had, I don't know if you know this application, LAHIB application, low income home energy assistance program. So many of the family members that we serve are, they lose jobs because of COVID-19 and then they were unemployed. So this program, LAHIB, will help them to apply for some of the help that they can get with their utility bills, with the gas and electricity. So many of our community members were able to get help by applying for LAHIB applications.
That's wonderful. And you feel that that the people are taking advantage or benefiting from the services?
Yeah, so I noticed that there were some people who were disconnected with their gas and electricity because they could not pay their bill because of their situation, because they were unemployed. They didn't have any income. So by applying for these applications, I could see that they were really thankful about this program, and then because of the help, they had to their gas and electricity was reconnected. So I think, yeah, many clients, the families were benefited from this program.
Thank you so much. And there was a note that Edgardo put in the chat that if you don't mind sharing specifically your resources or the link to those resources to benefit others that are on the line, and for which the Chicago Check can also place in our website so people could benefit from the services and many other activities that is happening in your organization.
I see.
So moving on, go ahead, Jerem, go ahead.
So we are
I lost you.
Yep, I think we lost you.
Oh, can you hear me now?
Yes.
Yeah.
Okay, so we're a community center in Chicago serving immigrants, and then we closely work with ICER. Can you hear me? I'm sorry. We are closely working with Illinois Coalition for Immigrant and Refugee Rights, and then most of the services that we do, we get it from ICER, and then I think ICER could be a really great source for everyone who's in Chicago, relating to public benefits program like SNAP, Medicare, Medicaid, and then there are many other programs that people in Chicago can benefit from. Like I know that ICER had a COVID-19 emergency fund for everyone who's struggling with the immigrant population. So it can be a really great source for you to reach out to us and then ask for some of the programs that you can help your clients at each organization.
We're losing your voice a little bit, Joram, so you may, if you could provide the link to those services, that would be great. But thank you for sharing those resources.
No problem.
So who else wants to address the issue about the biggest need in the community that you as an organization are confronting with right now? What are the biggest needs that people approach you at your organization wanting assistance? Is it food, emergency food that people need? Is it cash to pay rent? Is it how to navigate the healthcare system for either cancer-related issues and appointments? Is it for emotional support, trying to find out where can they go to talk to a social worker or a psychology or to get medication?
I'll jump in there. Be the Match, our organization is a little bit different. You know, we're very community-based. We're also a national nonprofit. And we work with patients, mostly blood cancer and sickle cell patients who are in need of stem cell transplants to survive. And unfortunately, because of COVID, you know, we typically add new donors to the registry at live events. You know, we're forced to operate virtually now, and it's much more challenging adding these donors. And so we're having to be, you know, much more creative and really rely on other community partners to help us do the outreach to get those donors. You know, our patients need the donors and they're just not there.
Yeah, thank you for sharing that, Terry. How can we be able to help your organization to make sure, again, that people will be aware of the services that you provide so they could be able to benefit from them? And this is not only to you, but to anybody. And I'm glad that there are already been some of you who are putting in the chat the link to your programs and agency. That's wonderful. That's one of the objectives and outcome that we want from today. So moving on with the question, what are the needs that your organization is unable to address right now? That you feel a sense of frustration because people expect you to help them and you cannot, either because of limited staff, limited funding, or because of many other unexpected issues related to the COVID. Terry, you want to say something on that?
Oh, I was going to finish the last thought.
Yes.
Just of how, you know, how other community partners can help. I'll give an example. You know, we're working with one patient. His name is Alfredo Diaz. He's 8 years old. He lives in Humboldt Park. He needs a transplant and he has no match, right? You know, he's been searching for 2 years and he needs to find a matching donor to survive. So we really just are doing outreach through social media, you know, to the community. So any organization can post a link on their social media, you know, and anyone could click on that link. Anyone 18 to 44 could click on that link, register and get a swab kit in the mail, swab their cheek and join the registry. It's really easy. But we need help getting the word out there. And that's just something really easy that any organization can help us with.
Thank you, Terry, for those comments and those sharing of those ideas. Anyone else about what are the needs that your organization is unable to address right now?
This is Ellen from Wellness House. We have seen a large increase in people reaching out to us for financial support, which is a service that we do not provide. So we do a lot of referring people to organizations that either do or might be able to get them to the right place, and either, local organizations that might be more focused on, basic needs, or kind of more national organizations that might provide some cancer specific financial support. But we are able to provide, the emotional support piece. We do a lot of that. That is the one of the main things that we do in support groups and counseling. And so we are able to meet those needs, but not some of the practical basic needs.
So that must be frustrating for you and your organization that people are coming for financial support or need, and there's limited what your organization can provide. But at the same time, you're providing wonderful services in the area of emotional support with counseling and group activity. And a lot of people are really in need of those services as well.
Absolutely. Yep.
So thank you for sharing that with Wellness Center. Anybody else that wants to talk about what are the needs that you feel that you cannot address right now in your community? Joanne, I don't know if you're still there and you want to make any comments about your experiences.
Hi, thanks, Aida. I am still here, and I was just processing a lot of the great conversation about unmet needs, and I think one of the big one is the personal touch and communication. One of the youngsters, because younger than me, said about being able to talk to people, be it text, them. The Zoom is helping a lot, but I think there's a big void, which is pushing some of the mental health issues because people are just not accustomed to not having interaction. So I think the more that we can check on our friends, our neighbors, and just do wellness calls and follow up. And sometimes even with my church, we drop our groceries on porches of people that may not ask, but have need. So I think that human touch of reaching forward and pushing is healthy and a good thing to do. And we practice that as well for the breast cancer survivors.
So I know that your organization, Joanne, also provide emotional support for many of the cancer survivor or people at risk, right?
Yep, that's correct. We have a LCPC, a licensed clinical professional counselor that is available for crisis intervention, family, and ongoing talk. So yes, we do. Thank you. And I'll also put that in the chat so it can be available.
Great, thank you for sharing. Any other thought about the needs that your organization is unable to meet right now? That you feel that we need to start providing attention collectively?
Well, one of the needs is transportation to and for appointments, because some of the ladies used to take public transportation, of course, if they didn't have PACE or something. And of course, with the COVID again, they're afraid to get on the bus because everybody is not wearing a mask. And again, being immunocompromised, it's like, so how do I get there? So one of the things that I do that is limited, I call for car service and send them to an appointment or to get medication. So looking at transportation, be it a van or something that's safe and clean, is an unmet need that we have in our area.
Is it worse as a result of COVID, or was that a problem ongoing?
It's worse with COVID, but it's been an ongoing problem because, as many of us know, when people are in treatment or sick, you don't want to be out in the public. So you do want a private or a personal person to take you because you may be nauseated, you may get sick, and you don't want to be exposed like this. So it is an ongoing problem, but it has increased with COVID, absolutely.
Does anybody agree with Joanne about transportation being an area of unmet need for your clientele or the people you serve in the community? Anna, do you agree? Jerome, Husnan, Jose, Jenny, welcome, Jenny.
I
Or
agree.
anybody
I know American Cancer Society used to provide a great service with the Road to Recovery program, and I believe that is on hold right now. I don't know what the plans are to get that back going, but I know there's been kind of a gap with that not being offered during COVID.
Okay,
Yes, I
so
agree.
you also experienced that as a serious problem. Thank you. Okay, any other unmet need before we move on? Joanne, you want to say something? Or anybody else who want to say something?
No,
Go
I
ahead.
was just, again, with, this is Joanne again. Again, just with the transportation, we've been looking for a van, you know, that we can clean up, sanitize, and spruce up to kind of serve with that. And we've checked around a little bit with the city, but some of the vans that they have are old, but we're looking for something safe. So I welcome any kind of input on transportation.
Yeah, anything would be helpful at this point to help our community. Thank you. Any
Sure.
other unmet need before we move on? Okay, the next question is regarding strategy. What are the strategy they have helped you to connect with your members and to keep them engaged during this period? And what difficulty have you faced? So can anybody address any strategy that is helping you?
This is Joanne again. I just have one that I want to share, that Beverly from UIC has facilitated for the last 9 months, and it has been the Zoom. We used to meet in person once a month, the third Thursday. So Beverly has helped to facilitate the Zoom, and it has been so unbelievable because not only have we met the market here in Chicago, which is our normal, we've extended to other states that have joined us because they can't get out. So Zoom has been very good. We play games, we have healthy thought, we pray, we listen to resources. And this coming Thursday, because of the Christmas holiday, we actually have the virtual Christmas party where everybody's wearing a sweater and bringing their best ornaments. So those are healthy interactions that even though you can't be there, you can participate in together. So Beverly, thank you publicly again for the Zoom.
So how exactly do you conduct this activity, Joanne? Is that through Zoom?
Yeah, we have a link that we send out to Zoom, and we've had between 20 and 40 ladies each month to attend. And we have to push them out because when it's over, they don't want to get off. So it's been very good, very participatory.
Wonderful. How has been the experience of others in terms of using Zoom and engaging them during this difficult time? Anna Williams, do you want to say anything? Jerome, Terry?
I can go. We utilize our social media. We have a Facebook and Instagram account, so we use those two social media and also our website to let our clients know that when our office is closed or reopened. And then we also posted like a flyers about the health education, some of the programs that we have to let them know that we are providing those services. So Facebook and website, our social media was a really helpful tool to let our clients and community know about some of the services that we provide.
And how about individuals that don't have access to the internet, or doesn't have a laptop or computer? Did they use their phone, their smartphone, or how do they go about?
So for the most, like 75% of our clients are seniors who are 60 and older. So we also had mailing services. So we printed out the flyer and then we physically mailed them to those clients who had a difficult time accessing like technology, a smartphone and internet. So mailing those flyers was a tool for them to assess those new information.
And who else are doing that? Mailing information to your client or members of the community?
So our staff, so we have a many department, and then some of the services for our department is working in charge of is a public benefits program like a Medicaid, Medicare, SNAP, and LIHEAP application that I just talked about. So those information was our department's job to do it. So me and my other staff was sending those flyers.
Great, wonderful. Sounds like you have a good system in place. How do you or anybody else know that those mailing of flyers and information are really reaching the people? Because sometimes in many neighborhoods, you don't have secure mailbox and the information get dropped in the floor, or the mailbox doesn't have a clear address for, name and apartment number or whatever the situation. Has any of you experienced those kinds of issues as well? I guess not. Any other strategy that works for some of you?
So something that we are hoping to start doing very soon, already working on this, is to provide swap kits in multiple locations. So for example, to small businesses that will agree to partner up with us, or like different places like dentists that or other organizations that will really be willing to just spread the word, to have them supply them with the swap kits and have them offer them to people who are interested to join. We don't have like anything to measure with other than if they register, we would be able to see this in our database on how many people register using a specific code. So this is something that we're hoping will increase the chances and maybe access for some people to be able to join, since we're not able to host any live events. So this is something new that we're considering to do.
Thank you for sharing that. And thank you for many of you who have put in the chat linkages that goes to your organization website and to any other resource that you want to share. So thank you for sharing. That's one of the objectives of this meeting, again, to hear about what's happening in the community, what is available, what is missing. So let me ask again, what may be missing or can be an area that we should explore further to provide to the community, because it's not sufficiently the resources available to provide the needed service. And again, the listing of questions, although I'm rephrasing some of them, is listed in the slide. So feel comfortable and address any of those questions that we would like to hear from you about it. We really would like your opinion. We're trying to document the community needs. We're trying to find collective solutions to see how can we make sure those resources are available. Jose in the past mentioned that many resources are available through the alderman and appointed official. Jose, I don't know if you want to also put in the chat any particular elected official office or link, if you have it available, the information that you could also share those resources, because there's a lot that is being done through the elected officials at the different levels of government, not only at the city council, but the commissioner, Cook County Commission, and the state of Illinois elected officials. So please, if any of you have access and know about those resources, also include them in the chat. Now, we wanted to hear if any of you want to share services that your organization offered that might be able to address some of the challenges and needs that we talked about. We mentioned transportation, or anybody, for example, can provide transportation that could help organizations like Joanne and her group and many others that are having transportation problem. Anybody have access to a van that can be share with other organizations as an example? How about any other services that we were talking about, emotional support? Some of you provide emotional support, but the need is so great. If there any way that we could find out if there are other agency providing, additional counseling, family help, group activities for people that may be in need to participate in any of those? Or can people be able to access those limited services that you're already providing?
Hana Center has counselors who and the counseling will be available in Korean and Spanish and English. So if anyone who wants to have a counseling sessions, they can make an appointment with us for the counseling sessions.
Is that free or paid?
Yes, it's free.
I was just going to say that Immerman Angels also offers free peer-to-peer cancer support. So anyone who is currently a caregiver or a patient who's looking to talk to someone who's been there, experienced the same things, to reach out to Immerman Angels.
Are those only for cancer survivor or people living with cancer, or can you also include people at risk for cancer?
We serve previvors as well. So yes, it's those who have a genetic predisposition or high risk as well.
Great. And Stephanie, did you add that information in the chat as well?
It's in the chat, immermanangels.org. Yeah.
Thank you so much. And Jerem, your information for your organization is also in the chat?
Yes, they are. The website, I posted the website. Yes.
Great, wonderful. Any other thought about what you are providing and your needs as an organization trying to address the needs of the community? There's question number 3 that we haven't really addressed. What services do you offer that you haven't found as high of a need or high in demand from your community? Is there anything that is being offered that people are not really taking advantage of? Any comment on that about services that people are not really taking advantage of and that is available through your organization or through other organizations and grouping? How about new initiatives related to COVID? Have you been able to get additional funding to do something that you were not originally doing, but due to the need, you are providing that services? I know that Jerome, you work with the Korean population you mentioned and Spanish speaking. Are there any things that you're doing differently during the COVID for which you may have received additional funding to do that maybe your agency were not doing so earlier?
So most of the clients usually come to our center like in-person and have an in-person one-on-one session with us for the programs that we do. But because of COVID-19, we had to close our center, and then most of our senior clients had a really difficult time having a virtual session with us, because we had to have a phone call conversation, and then most of the seniors prefer to have a one-on-one session face-to-face because they are not really feel comfortable talking with us when we are not facing each other. So I think that was the most difficult time that we experienced by having a virtual appointment. But then we didn't have any additional funding to accommodate the situation yet.
So this is currently a challenge for you with this particular population?
Yes.
And how about for people who don't speak English, whether they speak a different language, in the case of the Korean or the Latino, is that been a challenge as well during this period?
Yes. Also, when we get phone calls from our clients, we have an English, Korean speaker, and also Spanish staff. So when a client needs a Spanish speaker, we let our Spanish speaker caseworker know to reach out to them again in order to help them. So it was we could not directly help right away, but then we had other staff member who's speaking Spanish, English, and Korean, so we was be able to help them with the services that they need.
Thank you. And we haven't heard from Anna Michaelaski or Anna Williams. Do you have any comments to make on any response to any of the questions? I guess they're mute. I'm trying to find out who else have not had a chance to speak. They would like to at least Wanda Duke. Do you want to respond to any of the questions that we have been addressing? I guess she's on mute. Teresa, have you said anything that you before? We're almost at the end of the session. We want to make sure that people who have not spoken may say anything if they choose to. So Teresa or Laura, Nudi.
We can also, because we do have a few slides left, so we can probably go into just like a few local funding opportunities and assistance resources that we've just compiled.
Absolutely, yes. Why don't you go ahead, Edgardo, and take care of that and with Alicia. So basically, the slides here is about a few local funding opportunity and assistance that are currently available. One of them is through the Illinois Department of Public Health Center for Minority Health Services. They are currently requesting application from community-based organizations that serve minority groups to provide culturally and linguistic appropriate COVID-19 prevention and response strategy. And the main objective is to educate minority groups related to COVID-19. It could be prevention, it could be increased access to testing, it could be about the vaccination now that is underway, or to use community engagement approaches to improve quarantine and isolation compliance. And they are expecting to provide 10 to 15 grants or award, about $2 million they have available. And they hope that everybody who gets funded will receive up to $100,000. And they have almost a year to be able to use the funding. The application date can range in terms of when you could submit it. You could submit it from now to all the way to January 8th. And there's going to be a technical support tomorrow at 2 p.m. And there is the website information. All of you will be getting a copy, if you have not, of this local funding opportunity. You also have the Southern Smoke Foundation, the Chicago Relief Fund. And again, they are providing ongoing support. They have about $4 million available to help to fund funds for food workers, and the deadline is rolling, which means that you could submit it at any moment. And the information in terms of the link for the website is there. We also have an announcement of the Illinois Department of Human Services COVID-19 Immigrant Family Support Project. And so here, apparently they're providing funding for programs to be established to provide temporary and emergency assistance to immigrant and refugee with limited English speaking capability and who are experiencing COVID-19 related financial problem or any other housing, any other issues. So again, there's a link there for you, the resources. We are trying to put in our Chicago Check website additional resources as we find out about it, but we wanted you to take advantage of those activity. And then you have the South Suburban Cook Job Training and Placement Program. They have the COVID-19 recovery job training and placement for individuals that have lost their job. So they're providing funding to train and place individuals that have lost their job or have been laid off from different businesses. So again, $4 million being made available to provide those kinds of support training. And many of your organizations have the capacity to do that. So you should be able to link and apply for those funding opportunity, because our community, and this is one of the areas mentioned earlier, have a lot of financial need, and they need financial assistance, and training and job opportunities, one of them. And then finally, there is a NAMI, a suicidal prevention, which is a national, larger grassroots mental health organization dedicated to build better life for the millions of Americans affected by mental illness. So we know, as we mentioned earlier, that COVID-19 has inflicted a lot of emotional and mental health for many individuals. So please get that information, share with your client, have it available on your website so people could very well be able to know what is the hotline to call if they need any kind of mental health. And then you have here in this last page a series of COVID-19 and flu shot testing. So there are available testing sites that not only provide testing for COVID, but also flu shot, particularly for the elderly, people over the age of 65, should have a flu shot and should have shingle and should have other kinds of vaccine that is required to keep them healthy. So there's a wealth of information in the Chicago Check. And I think that Alicia already put the link to the Chicago Check website. We are constantly adding tremendous amount of information in our area, from food insecurity to housing, to testing, to mental health. And we want to make sure that all of you have the opportunity to add your resources. So when people look at our website, they could also know that there are wonderful services that all of you are providing in your community. So thank you very much to all of you for sharing your thought, for being part of this activity. I'm hoping that this have been helpful and valuable to all of you in getting an increased knowledge about resources available from each other and available from the Chicago website as well. Any final thought before we close? It's already 10 minutes after the hour. Any final thought? If not, well, thank you very much. And we're looking forward to our next webinar, which is going to be, I guess, February 18. We mentioned that earlier. So please look at our webinars, because we are constantly trying to do the best in providing diverse topics of interest to all of you. So thank you so much. Have a wonderful day. God bless, and nice holidays as well. Bye.
Thank you, everyone. Bye-bye.
Thank you.
Thank you. Take care.